Hi everyone, my name is Jessie Klein. I am the Director of Pelvic Health at Spear. Today I'm going to be doing a Pelvic Health Q&A Friday, so I am excited to talk to you all about pelvic health. Feeling of bulging or heaviness in the vaginal area is very common to feel after giving birth. Sometimes it can indicate a pelvic organ prolapse, meaning one of the pelvic organs is descending down into the vaginal canal. It seems really severe, but actually it's pretty common and treatable. So I was first exposed to pelvic floor therapy in my third year of PT school. I had never heard of it before. And it came at a time where I was starting to become more aware of gender inequality and how oftentimes women have these symptoms that are ignored. So I found the material really interesting, and I also just wanted to become a champion for women's health and pelvic health. So I really love being an advocate for women's health, and I do also treat male patients, but I definitely became passionate because of women's health. I also feel like the pelvic health community, so all of the providers that work in the pelvic health space, is really supportive, and we do just want our patients to get better. So it's a really rewarding field to work in. This is definitely not the first time I've heard this. You're not alone. But at our centers, you're welcome to bring your child in if you need to. That shouldn't stop you from getting the care that you need. Given, COVID and stuff, we just ask that where everyone is safe. And also, if getting into the clinic is too much or you're uncomfortable with that, we do offer virtual sessions. So that's a great option if you need to be at home but still want to get your therapy. The exam is different from going to the OBGYN. When you go to the OBGYN, they are looking at the organs specifically, whereas your pelvic floor therapist is looking at the pelvic floor muscles and the muscle function. So this depends on the Practice Act in your state. So where we are in New York State, you can see a physical therapist without a doctor's referral for 10 visits or 30 days. There are some exceptions with certain insurance or perhaps in a different state. So diastasis recti is when there is a separation between the two sides of the abdominal wall. It'll kind of look like a bulging or a divot in the center of the tummy. I do have a video of a self-test that you can do at home, so I'll post that on the next story. Yes, we do birth prep in pelvic therapy. So what we'll do is we'll work on some breathing techniques, we'll work on how to push, we'll work on perineal stretching and mobilization to prepare you for labor and delivery. On the next story, I'll explain what perineal stretching is. So perineal stretching is stretching the tissue here, the perineum, between the vagina and the anus. And what this does is it helps this tissue to become really mobile and stretch to prevent tearing during delivery. So men do have pelvic floor muscles and therefore can have pelvic floor dysfunction. A lot of times this will present as pelvic pain, pain with sexual activity, pain with ejaculation, urinary urgency and frequency, or constipation. Endometriosis is when the endometrial tissue, or the tissue lining the uterus, grows outside of the uterus. This can cause a lot of symptoms of pelvic pain, long, heavy, painful periods, infertility, constipation, and so yes, pelvic floor therapy can help. At Spear, we are in network with most insurance plans, so yes, your insurance should cover pelvic floor therapy. If you make an appointment, our front desk staff will verify your benefits, and you should know your financial responsibility. Difficulty with orgasm is actually very common and typically multifactorial, meaning there are multiple causes. So if one of the causes is pelvic floor muscle dysfunction, in pelvic floor therapy you fix the objective impairments in the muscles, and it should help with this issue. Pelvic floor therapy can help with constipation. So one of the reasons why people could be constipated is because the pelvic floor muscles can be too tight, and so the stool doesn't pass easily. So in pelvic floor therapy, you can work on releasing the muscles. One of the things that I always recommend for my patients who have constipation is using a squatty potty or a stool for your feet. What it does is it elevates your feet and it changes the angle of your hips and pelvis to put your pelvic floor muscles in the most biomechanically optimal position to relax. If you don't want to have pain with sex, but you're having pain with sex, no, that's not normal. So sex should be pain-free and pleasurable for everybody. So if you're experiencing pain with sex, this is something that maybe you could explore with a pelvic floor therapist. Incontinence with sneezing or stress incontinence is very common after giving birth. Typically this happens because the pelvic floor muscles are weak, so you can practice pelvic floor strengthening exercise or Kegels where you're pulling the muscles up. Important to note though, Kegels are not for everyone, so if you're confused or you're not sure if you should be doing Kegels, you should definitely go for an evaluation with a pelvic floor therapist. I've been working at Spear now for 4.5 years. I really do enjoy my job. It's such a positive work environment. I adore my colleagues and I adore the pelvic health team. So overall, it's just such a wonderful, collaborative, fun place to work. Another thing too that I think is important to note is that Spear is one of the few places in New York City that offers in-network coverage for pelvic health care. And I really feel like accessible care is so important in this field, and I just appreciate that we're able to do that. Great question. So on your first visit, it's super important that you know everything that's going on. Your therapist should be giving you all of the information, and you should ask any questions that you have so that you can provide informed consent. Consent is so important. That being said, a few questions I think that would be important to ask is, what's the examination process? What will you be checking for? What do you think is going on with me? And what is the treatment plan moving forward? So just like any other therapy, you should notice a change in your symptoms, and that's a pretty good indication of whether you're getting better or not. What free time? Just kidding. I like to go for runs. I love yoga. I love spending time with my dog Nala, just hanging out. I also love reading and cooking. I practice at the 30 Broad Street location in the Financial District in New York City. Shout out to all my 30 Broad people. Thank you everyone for joining me. Really glad that I got to answer some pelvic health questions. If I didn't get to your question today or you want to ask more, feel free to follow me on my page. Have a good weekend.